Yes, Akshay, your screen is visible.
Thank you
Please
for
go ahead.
confirming. So first is introduction to QAI. So QAI starts its operation in August 2017. It's the fastest developing accreditation body in the world. In a span of 7 years, we have developed 18 accreditation standards. Then this is our organization structure. QAI has four verticals. First is Center for Education and Training, then Center for Health and Center for Accreditation of Health and Social Care, then Center for International Accreditation, and Center for Accreditation of Veterinary Facilities. So Center for Education and Training is for trainings that we provide to the trainings that we provide. Then Center for Accreditation of Health and Social Care is for the accreditation of healthcare facilities, which include hospitals, small hospitals, clinics, hair transplant centers, then etc. Then Center for International Accreditation is for laboratories, inspection bodies, proficiency testing providers, then reference material producers, medical laboratories, and biobanks. Then we have Center for Accreditation of Veterinary Facilities. Then our programs in CHSC. So our board chair is Professor MC Mishra. He is the former director AIMS, New Delhi. Then these are our accreditation programs. First is dialysis centers, then green healthcare facilities, then clinics. Then we have ambulatory care facilities, then telehealth, hotels and homestays, emergency department, transition care centers, hospitals, WHO patient safety friendly hospitals, stroke center, vision centers. Then we have QAI 7101 plus, medical transport organization, hair transplant clinics, and assisted reproductive technology or IVF centers. We are about to launch hematopoietic cell transplantation and cellular therapy product collection, processing, and administration standard. Then these are our accreditation, healthcare accreditation that we have done in 7 years. For art IVF, we have done 58 accreditations. Then home healthcare, we have done 7. Dialysis center 8. WHO patient safety friendly hospital certification 1. Ambulatory care facility 5. Telehealth 2. Emergency department 10. Transition care center 4. Stroke centers 27. Hospitals 7. Certification of hospital 1, clinic 1, vision centers 19, and QI 7101 plus 1. So in total, we have done 151 accreditations. Then our international recognition. QI is the first accreditation body in India to achieve ISQA accreditation in less than 5 years of operations. Then QI is recognized by the Ministry of Health, central government scheme, health scheme for empanelment of private hospitals, eye centers, dental centers, and imaging centers. Then QAI is the first and only accreditation body in India having two standards accredited by ISQA. First is our home healthcare standard, and second is hospital standards. This is our accreditation mark, our gold seal, mark of sustained quality. Then, what are the benefits of accreditation? For patients, in an accredited organization, patients receive higher quality of care, safety of patient is given a priority, rights of patients are respected and protected, patients receive services by a credentialed medical and nursing staff, patients' satisfaction is regularly evaluated, and it provides an opportunity to the healthcare organization to improve, as well as it provides an opportunity to the patient to express their experience. Then patient gets an opportunity to be the part of their own care, patient-centric approach. Then for hospitals, accreditation enables the hospital in demonstrating commitment to deliver quality and safe patient care. Then accreditation assures community that the quality of services and better about the quality of services and better health outcomes. Then it also acts as a potential mechanism of risk management to safeguard providers from potential legal liability, and accreditation helps demonstrating the hospital functions in transparent and ethical manner. Then it is a process to stimulate continual improvement, act as a mechanism of self-regulation. It may provide opportunity for benchmarking by comparing their outcomes with other hospitals, and it provides an objective system of empanelment by payer, which government, insurance, and organization and other third parties. Then for staff, accreditation provides them with opportunity to staff at all levels for their professional development. Then being robust documentation and procedures in place, it also supports staff in building their confidence to deliver proper care, and it may help in building higher staff satisfaction because of good working environment, ownership of processes, and leadership opportunities. Then for third parties or stakeholders, it provides an objective system of evaluation and empanelment for payer and other third parties, and accreditation provides access to reliable and documented information on activities, facilities, infrastructure, and level of care. Then what are the objective of these standards is provide a framework for quality assurance and improvement. Then it focuses on patient safety and quality of patient care. Then set standards for quality and safety that organization must achieve. Then it is revised periodically to raise the bar and to achieve international recognition. So now we come to the hospital accreditation standard. So in total, we have QAI have 10 chapters, 89 standards, and 458 criterion. Then we have small hospital accreditation standard and certification of hospital. In small hospitals, we have 10 chapters, 63 standards, and 253 criteria. And in certification, we have 10 chapters, 47 standards, and 152 criteria. Then what is a standard? A standard is a statement that defines the structure and process that must be substantially in place in an organization to enhance the quality of care. And criterion is a measurable component of a standard. Acceptable compliance with criteria determines the overall compliance with a standard. Then this is the framework of hospital accreditation standards. So we have 10 chapters. First is governance and leadership. It has 7 standards and 22 criteria. Then human resource management. It has 9 standards and 36 criteria. Facility and risk management, 8 standards and 41 criteria. Information management system, 7 standards and 34 criteria. Then continual quality improvement, 5 standards and 25 criteria. Patient assessment and care, 20 standards and 108 criteria. Patient rights and education, 8 standards and 42 criteria. Medication management and safety, 10 standards and 53 criteria. Surgical care and safety, 7 standards and 42 criteria. And hygiene and infection control, we have 8 standards and 55 criteria. So total we have 10 chapters, 89 standards and 458 criteria. Similarly, in small hospital accreditation standards, we have 10 chapters. First is governance and leadership, 4 standards and 13 criteria. Human resource management, 7 standards and 21 criteria. Facility and risk management, 5 standards and 18 criteria. Information management system, 4 standards and 14 criteria. Then continual quality improvement, 3 standards and 14 criteria. Then patient assessment and care, 15 standards and 55 criteria. Patient rights and education, 5 standards, 25 criteria. Medication management and safety, 8 standards and 27 criteria. Surgical care and safety, 4 standards and 18 criteria. Hygiene and infection control, 8 standards and 38 criteria. So total we have 10 chapters, 63 standards and 243 criteria. Then for hospital certification standards, we have governance and leadership, 3 standards and 8 criteria. Human resource management, 5 standards and 11 criteria. Facility and risk management, 4 standards and 12 criteria. Information management system, 4 standards and 13 criteria. Continual quality improvement, 2 standards and 7 criteria. Patient assessment and care, 11 standards, 34 criteria. Patient rights and education, 4 standards and 18 criteria. Medication management and safety, 4 standards and 12 criteria. Surgical care and safety, 7 standards and 21 criteria. Hygiene and infection control, 3 standards and 16 criteria. So total we have 10 chapters, 47 standards and 152 criteria. Next is our accreditation process. We so when an organization asks for an application package, we provide them with 5 documents. First is information brochure, then application form, self-assessment toolkit, fee structure, and a copy of standard. So self-assessment is an Excel sheet which have all the standards and criteria. Then an organization first have to do the self-assessment of their organization. In that, they have to give the scoring, which is 0, 5, and 10. 10 is fully compliance, then 5 is partial compliance, and 0 is non-compliance. So they have to do the scoring, and if they are saying that this is present in our organization, then they have to mention, like if it is displayed in the organization or it is mentioned in their policy, it should be mentioned in the documentation column. Then organization do the self-assessment. Then they send the application to us. In application, they send us the application form, self-assessment toolkit, reference document, the documents that they have mentioned in the self-assessment toolkit, they need to share that with us. Then application fee. And in application form, there are certain statutory requirements that we ask. So they have to provide a copy of those statutory requirements. After that, we review the QI Secretariat review the application. They give a registration number to the hospital and acknowledge the application with an acknowledgement letter. After that, the documents are reviewed, and if everything is in place, then an on-site or remote or hybrid assessment is planned. Once the assessment is conducted, then the report is reviewed, including the scoring in the self-assessment toolkit, which is also filled by the assessment team. And if any non-compliance is raised, it is reviewed by the QA secretariat. Then an organization should meet the scoring requirements which are mentioned in the self-assessment toolkit, and they have to submit the corrective actions. Then the once the corrective actions are submitted by the organization and accepted by the assessor, it is reviewed by the accreditation committee, which includes the validating of the scores and whether the corrective actions are accepted or not. If the accreditation committee reviews recommended accreditation, then the uh, accre- certificate is issued, which is valid for 3 years. And after that, after 15 to 18 months, an on-site or remote or hybrid surveillance will be conducted. And before the expiry of accreditation, an organization has to apply before 6 months, and then the process continues from the application to from they have to fill the application form, self-assessment toolkit to apply for renewal. Next is fee structure. So this is for hospital and small hospital accreditation program, which is based on the size of the hospital. So for up to 15 beds, we have an application fee of 25,000 and an annual accreditation fee of 1 lakh. Then for 51 to 100 beds, we have an application fee of 35,000 and annual accreditation fee of 1,50,000. For 101 to 300 beds, an application fee of 70,000 is charged, and an annual accreditation fee of 2,25,000 will be charged for each year. Then for 301 to 500 beds, we have an application fee of 1 lakh and an annual accreditation fee of 3,25,000. For 501 and above, 1,35,000 is the application fee and 4 lakh is the annual accreditation fee. Then this is for certification. This is our certification fee. For up to 50 beds, an application fee of 2,000 is charged, and 2 years fee is 20,000. Certification is valid only for 2 years, and accreditation is valid for 3 years. So for 51 to 250 beds, its application fee is 5,000, and 2 years annual accreditation, 2 years certification fee is 50,000. And for 251 to 500 beds, 10,000 is the application fee and 80,000 is the certification fee. So now I open the mic for everyone to, if there's any query, they can ask if there any clarification is required. Am I audible?
Yes, ma'am. It is audible, but is
I've shared an email address in the chat box. If there is any query or if you would like to get the details, you can write to us on info@qai.org.in. Does anybody have any question? We also have a guidebook for hospital and small hospital accreditation program. If you want to procure that, then you can write to us on that email address, and a copy of the accreditation standard can also be shared with you if you are going to write to us on info@qai.org.in. If it is okay with everyone, can they switch on their camera so that we can take one photograph? So I've shared one feedback form in the chat box. You can give feedback on the webinar. And if you have any doubt, you can write to us on info@qai.org.in. And if you don't have any doubt, then we can close this session. It was very nice having you on this webinar. Thank you so much for joining, everyone.